So welcome. As we talked last Thursday, it was only 5 days ago, this is our second in a series of public health discussions. And last week we talked about what's coming down the road. NIH is setting up their workshop. The University of Kentucky does have their online survey active if you choose to take advantage of that. Tonight we're going to talk about what we've been doing from the time that derailment happened until today. And I'll show you the agenda here in a moment. But at your request, we brought back our partners from the Centers for Disease Control and the Agency for Toxic Substances and Disease Registry. We have partners from Ohio and Pennsylvania Departments of Health, partners from Columbiana County, partners from our Poison Control Center. Who am I missing? Anyone? Nope, I think I got them all. Okay. And then us, of course. I do want to talk to you a little bit about some of the organizational structure that we have that we've really never talked about before. But before we do that, first thing I'd like to do is just kind of go through introductions. So if each of our partners could get up and just say who they are, who they work for, and just a few other remarks that you might want to make. So, and I'll put the list up here before we go back to the agenda. So, Jill, you want to start?
Good evening, everyone. My name is Captain Jill Sugart, and I'm here with ATSDR, the Agency for Toxic Substances and Disease Registry from Atlanta, and I work in the Emergency Management Unit. Pleasure to be here. You're going to be hearing from me a little later.
All right, good evening. So I'm Arthur Chang. I'm the Chief Medical Officer of the Division of Environmental Health Science and Practice at CDC. I'm a medical toxicologist and emergency medicine physician. I'm happy to be here again today and talking to you about this accident. Thank you.
Hi, everyone. My name is Motria Caudell. I'm an environmental health scientist from ATSDR Region 5. We cover 6 Midwestern states, including Ohio. I've been out here a couple times before. And my counterpart from Region 3 is here as well.
Hi, everyone. Bob Helverson here. I'm from Region 3, the Mid-Atlantic states, so that includes Pennsylvania. I'm the Regional Director in Region 3. Used to work a lot with EPA as a contractor in the past on emergency responses, so that's my background. Nice to meet everyone.
Hi, good evening. Wes Vins, Columbiana County Health Commissioner. I'd just like to take a minute and thank all of our folks for coming out tonight. A lot of them came from a great distance to help us tonight. So I want to thank them and Mark for putting this together. Thank you.
Hi, I'm Kristen Dickerson. I'm with Ohio Department of Health. I am the state EPI for Ohio. I've done a lot of work with the ACE survey, and also ODH did help support the health clinic that's on Walnut Street, along with our local partners and with East Liverpool Hospital.
Hi, I'm Julie Miller. I'm the state toxicologist with the Pennsylvania Department of Health, and it's great to be here.
Evening, folks. My name is Katie Sneeringer. I work for the Pennsylvania Department of Health. I'm an epidemiologist supervisor in our Division of Environmental Health Epidemiology. Thank you.
Good evening, everyone. My name is Nate Wardle, and I'm the Special Responsive Projects Manager within the Bureau of Emergency Preparedness and Response at the Pennsylvania Department of Health.
My name is Shan Yin. I'm the Medical Director of the Cincinnati Poison Drug Center. We're the poison center that covers your community.
Okay, so thanks so much for all of you taking the time to come to East Palestine to do this, to support Eastern Ohio and Western Pennsylvania. As you can see, we brought a lot of talent to the room tonight, and that's why, one of the reasons why it took us a few weeks to bring this to you. You asked for it 2.5 weeks ago or so. But to make sure that we could get everybody here to hopefully answer all the questions that you have, this is the date we landed on where we could bring the whole team, which is great. From the agenda, I'm going to talk a little bit about unified command and what that means in organization, like I mentioned earlier, here in a moment. And then I'm going to turn it over to Captain Schugert, again, to have Jill describe some of the work that's been going on specific to some of the findings from the assessment of chemical exposure work that ATSDR did back in March, and also to address some of the concerns that you have raised, the questions that you gave us. We should be able to address some of those in those remarks. Of course, you'll have more questions, I'm sure. And then Dr. Yen will talk a little bit about what services the Poison Control Center offers. And then finally, we'll do a little bit of Q&A after talking about some community resources that are available. So with that, I just want to take a few minutes and talk a little bit about organization. And it dawned on me when we received one of your questions this week. One of the questions was, why did CDC and ATSDR go away after March? And it hit me that, you know what, they didn't go away. They've been working with us ever since, quite extensively, actually. We meet minimum 2 times a week, every week, through what we call our Public Health Advisory Unit, which you see up on the right-hand side. Your left-hand side of the organizational chart up there. But this is what the unified command structure looks like. So at the top of the chart, you see our incident command team, which consists of EPA Region 5 and Region 3, the Village of East Palestine, Columbiana County EMA, Ohio EPA, and in this case, we've brought Norfolk Southern into that mix because they're doing the majority of the operations to conduct the environmental cleanup out here. As you can see in the operations section below. And then through that, we have our assisting and cooperating agencies, and you can see the laundry list of agencies that have been working with us. They meet with us minimum 3 days a week to go through site plans, site progress, and we address their questions at those meetings. And then our Public Health Advisory Unit, which is all of these folks and probably about 30 other people in the public health community that help advise. And the questions that you bring to us, we bring to them, and we provide that feedback through our newsletters, through some of our remarks. And if we can't address your questions directly, then we ask the experts to do that for you. So again, I just wanted to give you a little bit of a feel about how the structure actually works. Just in the unified command structure alone, between EPA and Norfolk Southern, who has the majority of the people on site, plus all the other agencies, any given day we probably have 150 to 200 people working on this job site. So it's a pretty extensive effort to get this cleanup done. So I don't want to bore you with unified command talk. I know you want to talk about the reason we're here tonight, which is public health issues. So I'm going to turn it over to Captain Schugert to talk a little bit about the ACE survey and some other topics.
Great. Thanks so much, Mark, and thank you so much for getting this organized and letting us be here tonight. So again, good evening, everybody. My name is Captain Jill Schugert. Again, I'm here with ATSDR, the Agency for Toxic Substances and Disease Registry, and we are really here tonight to try to give you the information that we have to try to see if we can help answer some of the questions that you have. We understand that you have concerns about how the train derailment may have impacted your health, and we really want to work with you to try to address those concerns. I do want to say that I am so sorry that this has happened to you and that your community has had to go through this, and I know that the last several months have not been easy. So I do want to just acknowledge that up front. I really want to thank everybody who did get a chance to participate in our ACE survey. And again, the ACE that we did here, it stands for the Assessment of Chemical Exposures. And so I'm going to talk to you a little bit about what we found and what work that we've been doing. First, I'll talk about ATSDR because that's a really long acronym, and you may be wondering, I didn't know that agency existed, or what do they do? ATSDR is actually an agency that looks into health effects that are related to potential chemical exposures. And we do that for exposures that are natural or that could be man-made. We do this by responding to emergencies within the environmental health exposure realm, such as the one that happened here in East Palestine. But we also could do research on certain chemicals to find information. And then we also can assist our state and local health partners when requested if additional information or technical assistance is needed. And just wanted to recognize our great state and local partners that we have here, and just grateful for their collaboration in this entire effort. So here in East Palestine, Mark mentioned that we've all been working quite a bit during the last several months, and I wanted to talk a little bit about 4 key activities that ATSDR has been involved in. Our scientists have worked with the federal, state, and local agencies that I just mentioned to give scientific information that we have available about potential exposures. We also have helped coordinate public health activities across the federal, state, and local public health agency community, as Mark mentioned, specifically working within that public health unit infrastructure. We also have been helping with messaging to try to explain what we're learning about the health effects related to the train derailment. And then finally, we've been working on our ACE survey, our assessment of chemical exposures. We've done an investigation, and the reason why we did an investigation here is that we really wanted to try to learn how the release of chemicals has affected the health of people living in this community that were impacted by the train derailment. Again, the Ohio and Pennsylvania health departments, our colleagues here with us tonight, have invited us to assist them with this investigation. We know that all events are local, and so it's really critical to have state and local and federal partners at the helm. The residents and the responders who took our survey were able to tell us a little bit more about exposure, any symptoms that they've experienced, if they saw a doctor or if they went to the hospital, and how they got the information about when the incident happened. The survey also gave folks an opportunity to be able to share some of the concerns that they had about the train derailment. So CDC and ATSDR, we sent staff here to help with that survey, going door to door in February and March earlier this year. People could also take the survey at the Ohio and Pennsylvania clinics, and the survey was also available online. Again, I want to thank everybody who was able to participate in that survey, which really has allowed us to gather a lot of information. I am happy to report that 702 surveys were taken by community members and workers in the area between February 21st and March 31st. Most of the surveys were completed at the health clinics in Ohio and Pennsylvania. We wanted to share some of those early findings with you tonight. So in this survey, people told us that they had headaches, coughing, difficulty breathing, stuffy nose or sinus congestion, and burning nose or throat. We also saw similar symptoms in people that called the Poison Control Center, such as the one that Dr. Yen is representing tonight, or visited emergency departments in both Ohio and Pennsylvania. You may have also heard that some of our staff actually became ill when they went door to door during the ACE survey in the community. This did happen, so I want to acknowledge that. This happened when they were going door to door in the area closest to the accident. It is important to note that some staff conducting the ACE surveys door to door in the same area did not exhibit these same symptoms. So not everyone had symptoms that were in these areas conducting the survey. Our staff that did have symptoms had symptoms that are typical of those people who come in contact with chemicals released in this community. So similar symptoms of those impacted here by the train derailment. Some of our staff said that they experienced headaches, for example, while in the area, but the symptoms went away in a few hours. In the ACE survey, people also reported mental health symptoms such as anxiety, tiredness, difficulty sleeping, nervousness, agitation, and feeling hopeless. People that took the ACE survey also mentioned that they were worried about long-term community impact and long-term health impacts. People were also worried about their property values going down. We don't know for certain if there will or won't be long-term health effects from these exposures. The levels of exposures were, in general, much lower than those studied for people who have been exposed through their work. So, for example, through occupational exposures. That said, the physical and mental symptoms we saw are consistent with known health effects from environmental chemical accidents. We do expect symptoms to lessen over time. What we learn from the ACE survey can help the state and local health departments and others determine what the next steps should be. What we do know is that there is support for you all in this community to help you through this. We encourage anyone with ongoing health concerns in the community to call or visit the East Palestine Clinic. You can get primary care there, and you can also get health referrals and other services. Please take advantage tonight and talk with our state and local public health partners. They have developed information for you. They have fact sheets, both for Ohio and Pennsylvania, that will tell you what those specific services are and how you can access them. You may have also attended the meeting last week that Mark mentioned on June 1st to learn more about the committee that is being formed with the Department of Health and Human Services and the National Academies of Science, Engineering, and Medicine. ATSDR will participate in this committee. The committee will hold a 2-day workshop to explore potential surveillance and research opportunities arising related to the train derailment. So they specifically will be looking at priorities that they may want to put forward to research so that they can learn more. Community members will be able to give input to that committee. The workshop may help us determine if more surveillance or further research is needed. Again, we want to thank you very much for your participation in the ACE survey, which has allowed us to collect this information. I do want to let you know that all of us, all of our public health partners and colleagues up here, we're going to be here all night, so we will be available during the Q&A session, but we will also stay after. So if you're more comfortable speaking one-on-one, or if you have a specific question, please come and find us, because we really do want to be here with you all tonight and try to help answer as many questions as possible. So with that, thank you very much for your time, and I'd like to hand it over to Dr. Art Chang.
All right, so let's see. Yeah, so I just want to expand a little bit on what Captain Sugar has said. Mainly that the symptoms that we found from the ACE investigation are consistent with other investigations that CDC and ATSR has done in the past. So CDC has done several of these in the last couple of years where wildfires out in the West, right? So, you know, when forests burn, there's a lot of these particulate matter that sets off into the atmosphere, and people breathe it in. They have choking sensation, shortness of breath, severe asthma exacerbations, severe irritation as well, okay? And then the other ATSCR investigation that was done before that has consistent symptoms is chlorine release. So chlorine, if you guys go to a pool, right, you have the same sort of irritation in your eyes, your nose. You may get some wheezing as well as you breathe it in. And then you can also think that some people are more affected than others, okay? So that's the reason why, maybe your child still wants to swim away the whole afternoon while other, children have symptoms and need to leave, right? It's because we're all different, okay? And we all have, different, genetic makeup, and chemicals affect us differently, all right? So this accident, though, was very, very, complex because we had a huge mixture of chemicals, okay? So then how do we approach something like this? I would try to divide up, okay, the chemicals that are involved into things that would cause more of the acute symptoms, the symptoms you may see right away that may last, a few days to months, and then more of the latent symptoms that you may have to worry about later in years in life, right? So looking at the acute symptoms, those will actually be all consistent with the ones that cause the chemical irritation, all right? So the ones that were involved in the accident would include things like the acrylates, okay? The glycol ethers as well. And then also, after the vinyl chloride was burned, there's formation of hydrogen chloride, okay? So what does hydrogen chloride sound like? Chlorine gas, right? So if you're exposed to any of those chemicals, you may have this severe irritation. But what we know of those irritant effects, those usually, resolve. It may take some people longer than others, but eventually, you go back to baseline, okay? So in terms of testing for those chemicals, there's really not a lot, in the clinical area that can detect those exposures, right? Generally, a lot of those chemical irritants, like what I mentioned before, like particulate matter or chlorine gas, they're not absorbed into your body, into your bloodstream, and stay there for a very long time. So because of that, it's very difficult to be able to get any tests to figure out what happened. So things that you can do for that is do testing of pulmonary function or testing of the symptoms you may have from those exposures, okay? So now let's talk about more of the latent health effects and chemicals that may cause that. So vinyl chloride is one that everyone's worried about, okay? So for the testing of vinyl chloride, the most accurate and easy one to do would be to test the environment. Testing the environment, like air, water, okay? It's a lot easier than testing blood or urine or other parts inside your body, just because there's a lot of other things there. Blood has a lot of proteins, has other cells in it. Even urine, may have some other chemicals that would interfere with the testing. Okay. So for vinyl chloride, if you were exposed to very, very, very high concentrations, you can actually do a breathalyzer test for it. So you can breathe it out, the instrument can detect it, and give you a reading. The problem for that is that has to be done within hours after the exposure, okay? And then also, we're talking about really, really high dose exposure. Low dose exposure for the ones that we found here, right, likely would not really even show up because your body probably doesn't have enough of it to exhale out, okay? So then how do we test for things for lower exposure for vinyl chloride? There are a couple tests that are out there, and a lot of these were developed very early on, and they're really developed for occupational use, okay? So people that work making PVC pipes for vinyl chloride, okay? What they can do is you can give urine, and then you can test for markers of vinyl chloride exposure through the urine. The problem with that is that you're not testing the vinyl chloride itself. You're actually testing for a marker of it. So vinyl chloride, after it gets absorbed into your body, your liver starts detoxifying as soon as it hits your blood, okay? So as one of those metabolites your liver changes the vinyl chloride into is what you can detect in the urine. The problem with that, though, is that vinyl chloride, like other VOCs, go through the same pathway through your liver. So those tests for, it's called thiodiclycol acid, would not be very specific for vinyl chloride. it will actually pick up other exposures as well, okay? And the reason why this test, even in occupational settings, is not used anymore is because there are a lot of false positives, okay? So one of them is actually vitamins. There's studies done where people that take vitamin B12 and folate, which you can buy at GNC in the store, will increase your thiodicglycol levels, okay? Thiodicglycol levels are actually found in children as well. A lot of children are unexposed. They are, TGG levels that are elevated as well. Yeah, it is a possibility. I totally, yeah, I acknowledge that. Right. He, mhm. Mhm. Right. Mhm.
I don't eat raw onions like apples. I do not take supplements. I do not smoke. I do not drink. Where's it coming from for me? And we'll talk about those things, but we won't talk about the elephant on the tracks. And it's upsetting. And I've been looking at the documentation from the EPA, from the ATSDR, CDC. I'm going off the resources that you guys are providing and researching those. And I've called the ATSDR, I've called the CDC, I have a case number. I've never gotten a call back. I've called the toxic hotline. I don't get answers. You guys are the specialists. You're who we're leaning on, and you're leaving us high and dry to have nothing to do but sit here and worry. You said it goes through the liver, and the liver, it changes in the liver.
Right.
It also changes the liver.
Right. I was trying to get to that.
So I'm sorry. It's just.
I understand it can be very frustrating.
It's
Of
upsetting.
course.
None of you have to go home at night and sleep with this.
Right.
We do. We do. And then we're talking singular chemical and singular exposure.
That's right.
Right.
What?
Yeah.
And I'm sorry. I mean, I know you guys are here to help us, and obviously you didn't derail this train, and you didn't light these chemicals on fire. And I get that. I get it, and I'm not mad at any of you. I'm just.
We're frustrated just as you are. We're trying to tell you what we know, like where we're coming from, what we know about chlorine and everything else. And I know you researched this much, and you looked up all the resources, and the questions we got are very intelligent, and you want to know what the answer is. So are we. We're on the same page. I was just trying to explain to you that those values are all over the place. Even, yeah.
You had a resident who went through chemo.
Right, that's right. Exactly, that's right.
As a result of
Exactly. Absolutely.
I completely
Yeah.
understand that there are outside factors.
Right.
I get that. So I'm done.
Well, we can always ask more questions later. I mean, that's why we're here, right? So then I was going to say, though, that vinyl chloride in the environment degrades very rapidly in a few days. Okay, in water it'd be a little bit longer, but it'd be gone as well. Okay, so if this is vinyl chloride, then it's coming from somewhere, right? And the tests that are designed to test it and detect it at very, very low levels, even lower than what we can detect inside the blood and the urine, are not showing any elevated levels of concern. Okay? So then we have to explain where that vinyl chloride is coming from. That's all. That's all I want to say about that part, right? I know that there were some other questions, but I just want to make sure. Do you understand the issue about the metabolites and that we're not testing the actual compound, but we're testing metabolites? Okay, great. All right, so then my last point was that I want to make sure that you guys see your physician and work your physician, because all the testing that should be done with accredited labs through your physician. Okay, you need an order for a physician. And the important thing about that is that the tests that your physician can do will be the ones that are more important for surveillance. Okay, so if you see your physician regularly, they can detect changes. You were saying about the liver changes. You can see changes even before you have any damage to your liver first in liver function testing, and if needed, you can get liver ultrasounds, okay? So all those you can access through your doctor. The other thing that's important when you see your doctor is that your doctor can report any of those cases to the health department, and then we will know that there is a cluster of illness that are not explained, so that we can get more people and more resources here to help. Yeah, of course.
And let's say that out of 100 people, 20% are experiencing something.
Mhm.
And let's say out of those 20%, 15% has something to do with the chemical concoction that we've been exposed to. And these chemicals change your DNA, they break strands, change things, they change your makeup. How do you fix that? What's the treatment?
Yeah.
And there isn't one. It's
you're
just,
absolutely right.
now we know this is happening.
You're
now
absolutely right.
You just sit back and you're like, well, I'm right now because
So-
now I know that this is what we've been waiting on, and here it is. And now we just have to sit back and wait. So now we are the next 293-page report that there's a statistic, and now there will be human data from the next exposure, so we can say, hey, this is what happens. But what I feel is happening is we are not getting tested properly. Seviso was a chemical exposure that was in Italy in
Right.
1976. It's 50 years. So you have that 50-year window where you can look and say, here's how we tested it, here's how it looks. Obviously different chemicals, but there's protocol. We're being treated like there's not we don't know what to do. That is ridiculous. If we're going to be statistics, I want you guys to get the data right. If some of us are going to have, issues moving forward, health issues, or our children are, you need to get this right. So if this happens again, other people can be helped. That is imperative. And we are here saying, help us, get the data, take our blood, take our urine, take our DNA, take some samples, help us. And then, for how many months we got turned away at hospitals by our doctors. Oh, you have a sinus infection. No, it was chemical exposure. No, it's a sinus infection. Mercy Health, we won't even test you. We won't do anything. You have to leave. Active children.
No, that's not accurate. I know that we did not set guidelines to say no testing. Okay. That was not a message
But
that
that's
the
the
CDC
kind of
put
info
out.
we get.
I understand. I totally understand. So let me address the question about what we can do. Okay, you're absolutely right.
I want to help, but
Yeah.
I want to be helped.
Of course,
I
of
think
course.
that this is a mutual learning
Yeah.
situation for everybody involved.
So one thing that we can agree on, the exposure happened. It happened. We have symptoms. It's documented. That's why we did the ACE investigation. I don't think, like 80% of the people are making up stuff. The same symptoms. Not possible. Okay, not possible. All right? So the exposure happened already. The problem is that for us to fix exposure, we have to go back in time. And we can't do that.
Oh, yeah, no, it can't.
It's not possible.
Put that toothpaste back in the tube.
Right, exactly. Not possible, not possible. Okay, so then what do we do? Okay, what we can do then is first, if you're going to develop any sort of the really scary health effects in the future, cancer, for example, angiosarcoma of the liver, that's a cancer for vinyl chloride, we want to detect that early. So that's the reason why we're saying go to your doctor so that you can get examined and get the proper test. We know how to treat angiosarcoma. We may not know how to get rid of vinyl chloride from the body, but we know how to treat those cancers, okay? So one thing is to see your doctor so we can get that taken care of. The second thing is there are some things that you can do so you can prevent any further dysfunction in your liver. Things like if you drink alcohol, think about cutting down. If you smoke, think about these are all things that we can do that that are doable. Okay, but you're right. There is no way to get rid of vinyl chloride from the body. There is no way to get rid of dioxin from the body. No way. There's no treatment. You can even do dialysis. Like filter your own blood. Okay, not possible. Once that's in your body, that's it. The exposure happened, and the damage, could have happened. But excuse me? Into fat, yes. It's stored in fat, exactly. Right. Yeah, exactly. So you've done all your research, definitely. Really impressed. Right. Well, okay. So can we switch over to the dioxin? Or what do you want to do? You guys tell me. All right. You let me know.
Yeah, so, I think a lot of you may be familiar with the Poison Center, but just want to go over it. We are a local resource for you. We are based in Cincinnati. We were here before the accident. We'll be here long after. It's 24/7. We're available to the public and healthcare professionals. It's free. It's confidential. It's covered by HIPAA. It's essentially like a medical record. You'll speak to a nurse or a pharmacist. We can answer questions for you. I will tell you that we're not going to be able to diagnose diseases, especially over the phone, without a physical exam. One thing the Poison Center is very good at is kind of directing you to whether you should go, say, to the emergency room to get checked out immediately versus, you have time to see your doctor. And then we are available as well to physicians who then call, now they've seen you, they've done a physical exam, they may have done tests, and we can help those physicians kind of interpret those results. So I would also encourage you guys to call if you have symptoms. Again, Dr. Chang mentioned just in terms of surveillance, if there, say, is now a cluster, there's a number of people calling with an unusual symptom that we're not otherwise seeing, that may certainly signal something. And then we partner with CDC and other agencies to alert them to say, hey, look, something seems to be going on here. So certainly feel free to call with any symptoms and any questions.
And I've done that. And what they did to me was read me the chemical data sheet, and you may be experiencing this, and that's what they were offering me. So I'm not really sure. They told me that they couldn't give any medical advice.
So again, as you may understand, it's not easy for us to, say, diagnose anything over the phone without a physical exam.
Look at Google and get that. I mean, I feel like if you ingest a poison in Columbiana County, you're going to drop dead before anybody gives you any help, or you're going to have to call 16-1-866-877-888-800 numbers, and then they're going to. What this can do is cause respiratory distress when you are in exposure. I mean, come on. That's what I got. I mean, did anybody else call poison control? Am I alone? Jake, did you call?
Absolutely.
And what was your result?
Actually, my result was to call the CDC.
And what happened? And what happened when you called the CDC?
I got hung up on.
I was told, we'll take your case number, but you have to realize that we put evaluation of importance on this, and this may not reach an importance level of a return phone call, and I never got one. So thank you, CDC, thank you, Poison Control, and thank you all, because this is what the residents are dealing with.
Yeah.
You have a narrative, and but when you're on our side, and you're panicking, and you're worried about
the polling center should not have directed you to call the CDC. I apologize if that happened. If you're able to, if you know the time and the day, I can look that up. And if that happened, yeah, okay. All right. Now, please give me that information. The calls are recorded. I can go back and listen to that. If that happened, that should not have happened.
What number? I want to make sure I call the same number that you're saying that we should be calling.
Well, so there's a toll-free number, which is 1-800-222-1222. That'll work anywhere in the country. So 1-800-222-1222. There was also a specific numbers just set up for the residents. It was going to the same, it's going to the same place. Yeah. That one was only essentially going to direct, like if you were a resident of Pennsylvania, that would have directed you essentially to the Pittsburgh Polling Center. That was kind of the goal of that. But the numbers were going to go to the same place. So yeah, they should not have directed you to call another number. Again, if that happened, that should not have happened. I apologize, and I certainly can look that up. Yeah.
So I called 911,
Right.
and they said, and the lady was ticked, you're tying up my line. I said, I am doing exactly what I was instructed, and if other residents call, I'm just warning you, you're going to be getting more calls. So I called 911, CDC, ATSDR, Poison Hotline, and I have found more resources on my own through Google than you guys have provided me, and you have doctors, I'm sure you all have, you've got people there. Obviously, you're paying people to answer the phone. You've got staff, you've got research, you've got data. I don't have any of that. I'm one person trying to figure this out on my own. And I'm not even a great speller, to look this stuff up on Google. Thank God for spell check. I mean, who knows how to spell diagonal acid reaction? I don't know. I know now. But this is stuff that we so wanted you guys to help us. We so wanted that. I was raised, my parents were older when I was born. My dad was a military veteran, 24 years of service. I don't care. This is,
we do.
no.
It is time for you to be quiet. Let them finish it. You
So-
can talk to them
You need
later.
to be quiet, you've had your time. Let them give their.
They need to speak.
So I
because
have
no
learned
one
to,
will read
I
the
have
fire.
learned to respect these organizations and lean on them for the help. So what I am saying is, I'm listening tonight, but I'm listening and I don't know whether I believe you guys or not.
We hear you.
Because, well, do
They
you,
hear you.
have
They
you,
hear
well
you.
then if you
They
guys are
don't.
so confident in what they are telling me, then you two
You're saying- read
tell
out
me,
what you're saying.
where have you gotten answers? And I will listen to what you
I
say.
said, we all hear your complaint.
No, where do you get answers?
I don't have to say that, we hear you.
No, and that's why I'm here. I want answers.
We hear you.
Give us a few more minutes.
I want answers.
She's asking good questions, you need to stick together.
But not one person can ask all the
That's
questions.
all right,
and
you'll get a
some of them-
chance, you'll get a chance.
I think what he's answering to me is useful to everyone. His answers are useful to you and you, not specific to me. It's for this community, and I'm asking answers not just for myself, but for everybody here who is affected. Did you test positive?
I'm not playing your game.
I'm not
Well, hold on,
playing
guys.
your game. This is my
Hold on,
life.
guys. Guys, we have an hour and a half tonight. We have an hour and a half tonight. We got time. Okay? We've got time.
Yeah, I mean, just we're available as a resource to both you and physicians. So yeah, we're.
She's in Michigan, she left, so that's why she's telling me to be quiet. She's not exposed. Dose and duration is what we're dealing with here in East Palestine. She's in Michigan, so her thoughts are irrelevant.
Exposed. I lived
Irrelevant.
right by the fire.
Irrelevant.
Well, I'll be happy to answer questions at the end or at any time. Thank you.
So, and then the last piece, and then we can have some more discussion. Again, part of what you heard from Dr. Chang, we're utilizing community resources, right? So, Wes, can you just talk real quick about the resources that are available to folks?
Sure. Yeah, I'll just briefly. We've got together kind of a summary of local resources that we've got, and they're not just the medical resources. Obviously, you've got your local physician and your personal physician. But if you don't have a physician, Certainly, we've got the health clinic, which is right across the street, the permanent clinic. The temporary clinic is suspended, but we did put together with East Liverpool City Hospital and Ohio Department of Health, so we were able to put that together. They provide a list of services there. There's also the Community Action Agency's mobile unit. It's also in the community, so encourage you to utilize either one of those if you don't have a local physician, but you can utilize them even if you do have a physician. Addition to that, there's a whole list of other resources in the community, including stress counseling, perhaps. We had a lot of folks, I think, in the ACE survey, there was talk about anxiety. So, and maybe down the road, Mark, maybe we could even bring some of these folks in to kind of talk in more detail. I don't want to speak for any of these organizations or activities, but they're there. The sheet's out there at the table. It's got all the information. But if you don't, for some reason, grab one of those or don't remember, you're always welcome to call your local health department. We're here every day. We take calls from residents all the day, every day from the beginning of the derailment all the way through. So our staff are there to help navigate you through that process. So thank you.
So one other thing I forgot to say that, so if you want to be evaluated in person by a medical toxicologist, unfortunately right now in Ohio there are no toxicology clinics. The closest is in Pittsburgh, which is pretty close to here. It does require a referral by your physician. We can help that process. So if you call the Point Center, we can help, or if your physician calls the Point Center, we can help with that process. Hopefully there will be a clinic opening in Cleveland in the near future. I don't have a time frame for that, but that is another thing that can be done.
For Pennsylvania residents who are here, and I'm not sure how many people I'm speaking to who are Pennsylvania residents, we have things a little bit different in Pennsylvania. We are working with our trusted healthcare partners, just like Columbiana County is. But if you call our 1-877 number, which is 1-877-PA-HEALTH, or 1-877-724-3258, you will get our state health nurses, and they will be able to direct you to either UPMC, AHN, which is Allegheny Health Network, to Heritage Valley Health System, which is the local health system here for much of the community in Pennsylvania, and then also to the federally qualified health center, which is Primary Health Network, which is also who was on site at our health resource center that we had in Darlington Township. We have a resource document that's out in the lobby. Please feel free to pick that up. Our ACE fact sheet is also out there, and we also have a longer FAQ document, which is what Pennsylvania Department of Health and Pennsylvania Department of Environmental Protection have been updating really since the beginning of the derailment. But we'd certainly be willing to take any questions that Pennsylvania residents have as we move through the evening.
Kristen from ODH, anything to add?
Wes said it, but
Okay.
Just like Pennsylvania has put out a survey fact sheet, we have one specifically for Ohio too. Just the statistics are separated, so you can see Pennsylvania statistics versus Ohio statistics. So that is out there, and like Wes said, there's a whole sheet of resources that is available. We do encourage you to go to that health clinic that we have set up, because it is a way for us to know what is going on. It is a way for you to get care. It is a way for us to help and continue to support you.
Thanks, Kristen. Okay, so now we can move into more questions and answers. Yep. We'll get to that. Hold on. Hold that thought. So I did. One of your community members was unable to be here, and last minute she sent me a list of questions, most of which are for EPA to answer. So I'll get back with her on those. But the one that you all have the expertise on was actually it was two parts. One was have you considered using formulas or techniques to separate the levels of thioglycolic acid into a signal or noise amounts? And can that be done in conjunction with other studies? And the second question was, is there a similar type of biological test for butyl acrylate?
So I'll cover those questions first. I think what they're talking about is the identification of thiodiclycol acid using LCMS. For that, we looked at N to Z ratio, so it's a mass to charge ratio. Usually, you don't need to do that because if you have a standard, which is thiodiclycol acid, which you can buy, that's made for it, all you have to do is compare the amount of thiodiclycol acid in the urine to that standard, and then you can quantify it, okay? So the other thing I wanted to say about the TDGG that is not very accurate is that they found that people that work with vinyl chloride, even at very high dose exposure, they didn't really have very high TDG levels, okay? So not only does it like overestimate, but also underestimates. That's the reason now if you work to make, PVC piping, they will rely on air monitoring like what you guys are getting here from the EPA, okay? There was another question about the butyl acrylate. There was a research test for a marker, but again, that one's not used very often. So for butyl acrylate, the toxicity of that is actually, to me as a toxicologist, less scary than the vinyl chloride or any other ones, okay? We know that butyl acrylate may sensitize you to further exposures. So butyl acrylate, acrylates in general are polymers, right? I don't know who here used crazy glue before. That's cyanoacrylate. I don't know if you actually, when you used it, you took it was really close and you sniff it and you got all this like irritation and almost burn your nose. It's the same thing, okay? They're related, okay? But we know that after that burning is gone, a lot of that doesn't get absorbed, and then if it's absorbed, it's gone out of your body really fast. We actually have methyl methacrylate, another related compound that we use for medical uses. Bone cement, okay, it's methyl methacrylate. And then another acrylate is what we use skin glue for. So a lot of that we actually put in the body. So you imagine someone getting a hip replacement, they glue this socket with that methacrylate. So you're getting a lot of acrylates in there. Toxicity of acrylates, again, is a lot lower than the other ones. Benzene, okay, getting to that, okay? So what I know from the train cars, benzene was only a trace amount in there because it was not, it was found as a trace contaminant, okay? The problem with testing for benzene is that benzene is present pretty much everywhere, okay? When you pump gasoline in the United States has 0.5% to 2% of benzene, pure benzene. So that means that if you pump 17 gallons of gas in your car, 2 cups of that is pure benzene, okay? So if you can imagine everyone in the US pumping gas, all that stuff is just going to off gas, and that gets in the environment, okay? There are markers for benzene that you can test for, same way as metabolites, right? The old one that we use is urine phenol. I don't know if that's the one that you guys tested for. That one, again, is not very specific because urine phenol, there's phenol everywhere as well, okay? So chloroseptic spray, that sore throat spray is phenol. A lot of cleaning agents and disinfectants have phenol in it. So a lot of that could be related to that as well, okay? And then benzene is another volatile that usually is gone after, days to weeks after it's spilled. Yeah. Mm-hmm. Yeah. We're giving you information that we have. So that's yeah, I can't speak for stuff that we don't know, right? Yeah. Is there someone from EPA that can
Yeah,
answer
so,
that?
yeah, again, everything that was spilled in the environment, we're tracking. We know where the contaminated parts of the river are. We know where the contaminated parts of the soils are. And the only unknowns are what's happening just north of tracks and what's south of tracks, and our assessment's going to figure that out. So regardless of how much volume of oil was spilled, the investigation will reveal that. But the majority of it's already been cleaned up. Okay, so let's do some questions now. I know Barry's got a question. Did you have a point to make before I go to Barry? Okay. Well, Barry's been standing up and being very patient, so let me get to him, and then we'll take the dioxin question. So.
Problem I have is, we thank you for coming, but my wife died March 29th. Nobody was here. EPA was denying it. I called 11 o'clock at night one night. They came up at 11 o'clock in the morning to test the air. Slightly different air. No, according to the state EPA. Sorry, I know a little more than he does. He knew so much, he doesn't know how dumb he is. I told Mark to tell him that. But anyway, the state EPA has been a disgrace for us. They've been no help at all as far as I'm concerned. And I had to nail these guys till they started listening to me to find out that I knew something. I've been trained in this field, unfortunately. But we need help. The VA will not send the clinic stuff over to here because I'm going to the VA in Pennsylvania. That takes a problem. This is another thing we got to realize. When Devine put his dog and pony show in, the mental health finally sent a rep over. Well, she told me 2 weeks later that we didn't have the money to send anybody over there. I'm sorry. I was on the board 30-some years ago when she was hired. Don Roberts would have found the money to get somebody over here for counseling services. I was counseling in the Holiday Inn in Boardsman, some people from town. We need help earlier. We need not looking like we're covering up. As far as I'm concerned, the state EPA is lying through its mouth. And they got to prove otherwise to me. Federal EPA did. It took us a couple rounds. Just think, what did my wife die of? No doctors checked her. The doctor that checked, the nurse practitioner that she went to the Wine's Dog and Pony Show, she checked her, but her doctor wouldn't certify the death certificate because he didn't do the exam. Is this the kind of mental health we're getting and physical health we're getting out of our state people, our medical people? Thanks.
Thanks, Barry. Okay. Did you want to ask the question? Okay. What was it, the dioxin?
Yeah.
No, I want to hear about dioxin.
Okay.
Okay.
My questions were for other things.
Okay.
All right. I'll just be, yeah. I'll just
So
be
what
brief
was the
about-
actual question?
Yeah.
No, the
dioxin.
dioxin question. I heard
The
the word dioxin,
testing,
but I
or
actually
what
didn't hear
were
a
we
question.
talking about? I think it was the testing. Okay. All right. Got it. Yeah.
We're not testing for them.
Right.
Why?
So the reason is, dioxins have been phased out since the 1970s. Okay, so dioxin is not manufactured anymore. All right, dioxin. Oh, really? Okay, great. So that may explain some of the levels. Now, so dioxins, though, could have been formed from the combustion of vinyl chloride. More commonly, though, is formed from the burning of PVC, not vinyl chloride, but PVC, okay? The problem with measuring dioxins is that dioxins are everywhere, okay? They build up in the food chain. All the plants have it. The majority exposure for the United States for dioxins will be from like landfill burning and burning of trash and other vegetation. Wildfires, like I said, if you test for dioxin, they'll probably be higher because those are liberated, right? plants and animals eat the other animals and plants, and they just build oxygen levels build up in the food chain. So you're going to have a lot of that. For the average United States person, dioxins comes from a diet. So if you eat a lot of red meat, you're getting more dioxins just because it's bioaccumulated in the food chain. Okay? So, the CDC actually tested for dioxins on everyone in the United States using a modeled approach. It's called NHANES. It's a study, volunteer study. We have data. The last time they did that, though, was before 2010 because it was very, very low levels at the time. So what I was trying to say for dioxins is that we have time if we need to test for that. Dioxins have a half-life of 7 years in your body. There's a whole bunch of dioxins, okay? Whole family of compounds. What we're worried the most medically is something called TCDD. Yeah, there you go, okay? But that one, though, is very long in the body, and if we test for it, we have time. There's no time window that we have missed for that. The problem, again, is we come back to the same thing of what to do if you find it, right? There's no way to get out of it, get rid of it out of your body, okay? And dioxins, usually the most known health effects that we know from it is something called chloracne. And this is acute exposures to dioxins, okay? And you get these eruptions that looks like, yeah, but it's not, if you look at pictures, historical, yeah, it's disfiguring. It's like people have scars. It's not the typical acne. We're talking about this is severe. So, yeah, so if you have anyone that you think has that, you should go see your doctor. Okay? All right, so then going back to dioxins, was that dioxins have been tested in the environment, though. So the dioxins in the soil around that area are the same as the background in other places. So then where is the dioxin coming from? That we will have to, dioxins have to come from somewhere. They're not being manufactured anymore. No, there's dioxins everywhere. No, there's dioxins everywhere. There's dioxins all over.
She's asking an environmental question. Yes, there was dioxin found in the waste, about 7 to 800 parts per trillion. Yes. Yes. Yeah, 7 to 800 parts per trillion. In the waste. The waste is a conglomeration of all the. I'm sorry? Yeah, we've sampled it. Yeah, we have 1 mile by 2 mile. Yeah, oh yeah, we have lots of it. Oh yeah, I'll show you the data. I'll show you the data. I'd love to show you. Yeah. 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 Okay, so let's get back to questions. So do you have one? Okay.
Okay, of the 702 ACE surveys that you received, how many of those were completed in Pennsylvania? Do you know how many people live in Darlington and Darlington Township? Well, let me help you with that. There are over 2,000 people residing in that small area, and you had 100 people respond. Okay. There are over 4,000 people in East Palestine, so out of 7,000 people, you had 1% of the population respond to your test. And let me tell you why you only had 1%. Because somebody at the CDC had the bright idea to put out a webinar to tell our doctors not to see us at the end of February. Now, I don't know who the brilliant person was behind that, but I talked to my doctor on March 1st, and he told me, I can't see you. You have to go to the clinic. I'd already heard the stories about the clinic, okay? Now, I'm going to tell you that my daughter has been throwing up since February 3rd. And if I hear one more person tell me, well, that's not possible. You're 3 miles out, I'm going to scream. Because I'm going to tell you something. We are 3 miles out. My husband and my daughter tested last month. My daughter's benzene test just came back. Her vinyl chloride test just came back. They are double double what they should be. My husband's vinyl chloride is positive. I didn't test positive for vinyl chloride, but I did for benzene. And I don't want to hear the vitamin B12 story, because I've heard that. Because you know what? I take vitamin B12 every day, and so does my husband. But he tested positive, and I didn't. Okay? I can't get the EPA to come out and test my soil. You know, I talked to a gentleman right before Memorial Day, because I went to a meeting for businesses that I don't own one of, and spoke directly to Governor Shapiro and told him, what are you doing for us? Nothing. Pennsylvania hears nothing. It's crickets. I have to come here to get information because they don't hold any meetings for us over there. No offense, okay? I just want you to understand that. But I went to him and told him, and he got a hold of the EPA and told them to come test my soil. I'm still waiting for that phone call, okay? Paul Vogel called me. Do you know who Paul Vogel is? He's with the EPA in Pennsylvania. Very nice young man. Called me and said, our group will be contacting you. This is June. Nothing. I had to fight to get my well tested, which I'll probably have to fight to get that tested again, because we're not drinking the water out of our well. Because we have been sicker than we have ever been in the 25 years that I've lived in my home. 25 years. And I've watched my child at least once or twice a week get up and throw her guts up, or in the middle of the night. She went to the doctor and he put her on Zofran. He also tested her vinyl chloride and her benzene. And do you know what his response to her was? I don't know what to do to help you. That's what he told my daughter. He didn't tell her to call the CDC, poison control, or anybody else. I don't know what to do.
Yeah, the doctors need directions.
Okay? They have no idea what to do.
Yes, they do not
Okay?
know what to do. They need education.
Okay, so my other question, and they're going to be short, okay? How do you agencies communicate with each other? How do you do that? Okay. With everybody? With everybody. 2 times a week in Ohio. And with PA? You guys are in on it too? Okay. So I want to know who the brilliant person is that doesn't know all the residents that live in Darlington, because let me tell you, when this happened, you missed a lot of people. Okay? Because your maps don't match. I don't know what to tell you. There's a lot of elderly people in our community. They are not going to come fill out a survey, and nor do they have the internet, nor do they have Wi-Fi. They don't know what a computer is, nor do they know how to turn it on. Okay? So maybe you ought to come door to door in PA and see where we're at and how we're feeling, because I can assure you that we have all been sick 3 miles out. Not 1, not 2, 3. And every time they were digging those tracks up, that dirt, we were sicker than before.
Can I add,
Go right ahead.
Darlington is an older community.
Yes.
The majority of residents there are older.
Yes, they are. No.
So to reach those people, it's a little bit more difficult to reach them by internet.
Mm-hmm.
And, you know, how is that, how's that possible? How can we make that happen?
Yeah. I mean, you have people that are sick. You don't even know they're sick. You didn't know I was sick till I came here. You know why? Because none of you have bothered to even call anybody. We all have phones, okay? We all have addresses, and you should have them. Because Lord knows you have my address when it's tax season. Anyhow, can the PA residents access the East Palestine Clinic? Because we don't have one in PA.
Ask your PA people.
I'm looking at them. I'm waiting for an answer.
As I said during the resource section, we've largely been using the healthcare providers in Pennsylvania. I know that you said that
They don't know anything.
been to your doctor, and that because state board, this derailment knows no borders.
Oh, yes, it does.
It was 500 yards from being completely in Pennsylvania.
I beg to differ with you, but that they do know borders, because according to their map, I'm not included, and I can see my neighbor who is. They
But-
do have borders.
Unfortunately, many of our health systems operate in borders.
I understand that.
And so what's working in East Palestine and with the Columbiana County clinic that they've opened up is with a healthcare provider that's based in Ohio. And so the
Okay.
healthcare providers that we work with typically in Pennsylvania are ones that are, of course, based in Pennsylvania. And so that's why our resources are referring people to AHN, UPMC, Heritage Valley, and then to the FQHC. which is
Except when
primary.
these people wanted the help, you people put a webinar out and told their doctors not to treat them.
Well,
So you think they're going to go back to their doctor now because these elderly people are under the impression, well, my doctor can't do anything for me?
They don't want to go to the doctor in the first place.
Exactly.
They don't wanna go back.
So Ohio and Pennsylvania both did a webinar with providers in the area,
Yeah.
but it was to inform them about the derailment, what was going on, and to give them resources.
No, it wasn't.
Yes, it was.
I'm going to tell you because I talked to the wife of a doctor at our township meeting. She watched that webinar with her husband, and they told him to tell people that came to him, I can't treat you, go to the health clinic.
So the one in Ohio, and I think this is what Pennsylvania said as well, it was to give them resources. We provided toxicology experts to come on, and it was really to inform providers on how to help the issues and what was going on in the community, because we did hear that from the providers that our providers didn't know how to handle it. So we really tried to put on a webinar, invite all the providers within the area and inform them. And if that's something that needs to occur again, or reach out to the providers, that's something that Pennsylvania and Ohio can take on, because the last webinar, I think, was a few months ago.
Well, I will tell you that I have emails from my doctors telling me, I can't do anything for you. You have to go to the health clinic. I have emails. That's right. It shouldn't. Exactly. And we should have a clinic in Pennsylvania. I'm sorry. We should have a clinic in Pennsylvania. Don't send me to a hospital. If my doctor can't help me, then by golly, there better be somebody, someplace there that can. Because this is my life, my husband's life, and my child's life that I'm talking about, and my grandchildren, okay? Because they're next on the list to be tested because they spend a lot of time at my house. And they're little, and they don't deserve this, okay? And I would like to know what tests are accurate. If none of these tests are accurate, what tests are accurate? To tell us what we have. If me peeing in a bottle or giving my blood is not accurate, then what is accurate?
They base it off of the air, right? So we were told that the air monitoring, air is good, but the particulate count, we never really got that. And then we find out, well, maybe these air monitors aren't quite as sensitive as they should be, because if we're picking it up at certain levels, then our test will make sense.
So-
If we don't pick it up at those
Linda, hold on, hold on.
Monitor at my
Linda,
house.
hold on. Her question was about biological monitoring, not about environmental
That's
monitoring.
exactly right.
But the biological monitoring comes in and it can be debunked if it's not in the air, because these tests don't make sense because they correlate with the air monitoring numbers. And if the numbers of the air monitoring aren't showing it, then they're gonna say, well, you know what, she's got this from pumping gas or eating onions.
I don't pump my own gas. My husband does that for me, by the way. I'm old-fashioned.
That's why there's a connection.
Yeah, but again, you're asking, are there other
I am.
medical tests?
That's what I'm asking,
Yeah.
because he's telling us that these tests are not accurate, okay? Which I understand that. So what is accurate? What test can I take or have my husband and my daughter take that are accurate?
Well, I'll just remind you again that you can be potentially seen by a medical toxicologist in person. It's in Pittsburgh, so it's in Pennsylvania. Yeah. Well, so, no, but there is a clinic that exists. It requires a, well, the-
It's not accessible to you, only your doctor can call that number and make the appointment for you. You cannot get that number.
exactly right. Well, we can help if we can help the physician. Like again, we couldn't necessarily help. Like if you called, we could not make an appointment for you. We can assist your physician. We have kind of the number that needs to be called. We have, like, the toxicology clinic wants records, kind of facts before people are seen. So we have all that information. So there is a clinic that can be seen. It's in Pittsburgh.
She's correct. You need to do another webinar, and you need to educate the doctors on this, because they don't know.
Yeah, yeah.
Their guidance too. And I'm a doctor, I gotta go to another clinic.
Yeah. And, yeah, no, that's a failing on our. That's certainly a failing on our part. We could probably do a better job of advertising that. But yeah, it is not just open to a public phone call. Correct. Yeah, yeah. But it's an outpatient evaluation by a toxicologist. Yeah, it's like getting referred to, say, a cardiologist. I mean, most people can't walk in to see a cardiologist. Your doctor, right, sends you to see the car. It's the same thing, basically. And hopefully, like I said, I'm not going to make any promises in terms of timeline, but hopefully one will be opening in Cleveland soon. But and we would have that information when it was available.
And Nate, right here, it's coming.
Yeah, it's via University of Pittsburgh. Yeah, so.
So the medical toxicology outpatient clinic at UPMC Presbyterian, which is the main hospital in downtown Pittsburgh, it is run by Dr. Michael Abasemis, and it is at 200 Lorthrop Street in Pittsburgh. Now again, you can't just show up there and expect to be seen. You do need a referral from your physician, and I just Googled UPMC medical toxicologist, so you could do the same and find their website. But it talks about what you need as far as your primary care or treating doctor to refer you, and then they need your medical records. But certainly, now that you have the name, hopefully you will be able to look up his information and be able to find that, and hopefully it will be useful for you. Okay. Last name is spelled Abesamis, and Michael is typical spelling.
Okay, I got a question back here, and so because we're getting close on time, give me some hands if anybody else has a question.
My question is just kind of statistical. I don't know if anyone in this room can answer it. I will say my name is Barbara Georgescu. I'm living in my daughter's upstairs bedroom in central Michigan. I lived on Alice Street and ran like a deer and never went back there to live again. Why? One, I have a lot of allergies and are sensitive to things. Two, I'm an environmentalist who wrote a local paper on this city, Beaver County and Columbiana County. It's in the local libraries. There were hundreds of copies. It's called Region Under Siege. It was written in 1993 about the environmental messes that were already here. And we all know we live in Cancer Alley and so on. We all know about that. But anyway, my question is, just for East Palestine, because we know there's, 4,000 some hundred people. And I want to know I've been walking around town asking people, are you having symptoms? Are you having symptoms? Just kind of doing my own little thing. I want to know what percentage of East Palestine has complaints that are physical? I wouldn't say anxiety, but what percentage of people in town are affected by this physically as far as somebody knows? Does anyone know that?
I am going to actually direct you. There's an ACE survey result printout, front and back, and it's got some of those statistics on it. It talks about some of the concerns that were brought up in the ACE survey. It talks about some of the top symptoms that we're seeing. It talks about people that reported symptoms in their pets or livestock. It talks about the percentage of people overall that reported symptoms, but it's a whole sheet that you probably will find helpful. And there is one for Pennsylvania as well.
Would you call it high percentages of the population or low percentages?
So of the people that completed the ACE survey, which I think it was roughly around 500 people for the state of Ohio in terms of people that worked or lived in the East Palestine area, it was a high percentage that was reporting some kind of symptom.
Okay, thank you.
I will also say that this has been released in Governor DeWine's outbriefings since we started running the ACE, just so we could share information.
What was the percentage for anxiety?
That was very high as well. And that's actually, that information is actually in the,
Okay, so you don't know the number on that. I was just making sure that we weren't placing, more importance on the anxiety over the physical symptoms, because I think they're hand in hand. When I went to the clinic, they're like, well, do you have any unexplained anxiety? And I looked at her and I'm like, well, I think it's pretty explained. I can show you why.
it absolutely is explainable because you guys have been through a traumatic event, and
I don't know how you they do go hand in hand.
yeah. So how the ACE survey kind of looked at that was reporting of physical symptoms. So that's why we did ask, what were your symptoms? Was it a runny nose, a cough, eye irritation? But then that's why they also asked the component about mental health. So
They're both important.
yes, absolutely. Mhm.
Yeah, my question is for the toxicologist. I don't know if maybe you can tell me or not, other than me just telling myself that I probably should stay away. But for me, continuing, my tongue is numb. I still feel like I don't know what vertigo is, but that dizziness, feel like you're on an elevator, and that hits me a lot. Some abdominal pain, at least maybe every 2 weeks, 1 or 2 days of it. I've passed kidney stones, and they are not stones. So as far as, and then it's almost like I'm hypersensitive. Like, we'll go to Walmart, and if I bag the groceries, the smell of the plastic bag will put me into like crazy overload, with the tip of my tongue. It's almost like a hot pepper oil on it or something. I don't know if you have any insight on that, but of course we come back to Palestine because, we're close and this is where the meetings are. But, and it isn't just when I come back. It's been that way since February
Well, just to
10th.
clarify, it's not coming back. We live 2.8
Yeah,
miles away.
yeah.
So we're here. But just like Lori was saying, you say, well, there's no borders. Well, there is a border, and we were told immediately 1 mile, 1 mile, 1 mile. That was beat into our head. So we're almost like we're 20 miles. So we're out of 1 mile. So we're kind of shunned. But we're still experiencing things that are mirroring exactly what residents in the village are experiencing. So we did question our own sanity. We did. They thought we were crazy. But we're not.
Yeah. So, yeah, the first thing that, insight that I can offer is, one, okay, you asked about the testing, right? Like, do we really need a test to prove you're exposed? No. Yes, that's common sense, exactly. So then you have to ask yourself, what is the reason for the test, right? The test should be something that your doctor can use to treat you. If a test is high, you do this. Test is low or normal, you don't have to worry about it, okay? The problem is that we don't have a test that's specific enough to tell us that. And we can't go back in time to get those levels, okay? For your problem, though, the first thing to do is to rule out all the common things. And this is exactly what the medical toxicology clinic will do. I used to work at the one in Atlanta at Emory University, okay? So you bring all your records, all your levels you've done already, so we have a baseline, and then we will sort through each and single symptom that you have, and then see if it can be explained by something that's more common, that's treatable, or something that could be really, really, dangerous for you, rather than let's just assume it's due to the exposure. The tongue numbness, right? That can be due to many things, but if you have numbness on one side of your body, I wouldn't be worried about stroke. We have to rule out stroke first before we say, well, you know what? Let's test for dioxins. But even when we get the level back, we're not going to be able to manage it, right? So that's the first thing, okay? And then the second thing is that, what you mentioned, that anxiety is high. PTSD, and that's a normal reaction, okay? So our minds will associate things to what you experience when a very traumatic event happens. Exactly, that's right. I can tell you, I was driving here, and we were stuck by the train. And I had thought back to February, the end of February, we were here. And how scary it was and all those things, okay? And I'm a physician, I understand all those things, but I still, those thoughts came into mind. This is the same thing, okay? But we know that with the right treatment and exactly what we're doing research, finding more about, and taking control of these symptoms is the way to go. Those symptoms you're having, the association between the fear and those symptoms will eventually go away. Right. So, yeah, the next one you find, or even the last one, you can say, hey, listen, all I need from you is a referral to this toxicology clinic. That's it. All you need to do is sign that piece of a referral, and then send those records over, or give me your records, and I'll take them over there. And that's it. And you don't have to, they'll take care of all the workup, any testing that needs to be done, anything else, they'll take care of.
Okay.
That's true, yeah.
Okay.
I know.
Yep. I want to do, she's been waiting patiently. I want to do this last question, and we can talk one-on-one after that. Okay?
Perfect.
Does that sound good?
Sorry I'm late. Sorry I look as bad as I do as doing stuff outside, but... Oh, I'm sorry. I said I apologize for the way I look because I was doing stuff outside, but my question is workman's comp is testing the first responders for heavy metals for the next 7 years. So the first responders can be tested, but the general public can't? This is what I don't understand. I would love for someone to answer that question for me. Anybody?
So I'm unsure of workers' comp actually testing for the responders. I do know that there are several research studies that are working with the firefighters to try to get them enrolled in cancer registries, and it's national. And so, to my knowledge, workers' comp is not paying for the testing. It's the research studies that have come in to set the firefighters up on cancer registries. And it's not anything for seven years, and they wouldn't, for workers' comp, my understanding of how it works is that they would have to file a claim. They're not going to, across the board, test everybody. They would have had to file a claim. And that has to do specifically with their exposure and their response, because you have to think a lot of these are firefighters and they're continuously exposed to these kind of chemicals. But I do know that there are research studies that are geared towards firefighters specifically. And this has happened in other, I'm guessing it probably happens in wildfires too. trying to get firefighters associated with registries so you can track and follow some of their exposure levels, and then testing to make further recommendations for the future in terms of PPE training. And I don't know if Jill has anything to add. So I wouldn't know about, so I don't know anything about the workers' comp claims that are coming in, because for Ohio, I don't work at BWC, and I don't actually know how Pennsylvania is set up in terms of the workers' comp claims. So we wouldn't see specifically. Yeah, so Jill's going to add something, and then I'll circle back if there's anything missed.
Great, thanks, Kristen. So I think yeah, exactly. So you were late, so you may, no, please don't apologize. I was just saying that in the beginning, we talked a little bit about a workshop that is going to be coming up specifically to look at research priorities for community members, where community members will be able to provide input into that process. There's also some researchers that are applying for grants with the National Institute of Health. I know last week, I don't know if you were able to make the June 1st meeting. Were you able to make that meeting? If not, it's okay. They were talking about some opportunities for you. And so ATSDR is actually going to be partnering with the Department of Health and Human Services and the National Academy of Sciences, Engineering, and Medicine to do this 2-day workshop. It's not going to be for probably a few months, but this will be an opportunity to look at what you're asking, is to look at what needs to be done for the longer term health effects, and that could include biomonitoring or some type of testing. So there are agencies out there looking at community members in addition to first responder testing. Sure.
There are some metals which can be pretty easily tested for. Your doctor can do it. Lead, mercury, arsenic. Just like Dr. Chang had talked about, though, there are problems trying to interpret those sometimes. For instance, seafood especially has a lot of organic arsenic, which is essentially non-toxic. So that if you had, say, a big seafood meal and then you had your arsenic tested, it actually could be very high. Rice can too. So, but it's a non-toxic form. So that's again one where you can talk to your doctor, but generally, and oftentimes they call us to help interpret those results, but sometimes it's just not done right, and then it has to be done again. So it's one of those things where generally you don't want to just willy-nilly do it, but there should be some forethought having it done before it's done.
You feel somebody dropped the ball in the beginning of this whole situation, not fingerprinting us, as the further we go out, we see the different levels, start out at the ground zero, we work our way out, and testing to us in the community, you see what the level of dioxin, like taking fingerprints with the bricks down, from independent testing, the check will run, they see that dioxins are a lot lower than here, the same way they check for
Well, I will just say again that you can call that. You may not get the answer you want. It may be very similar to Google. I mean, Google's pretty smart, so the information is often correct, but we are available 24/7 for questions at the Poison Center.
Okay. And Kristen, then we'll wrap it up.
So I think that this has already been stated. It's it's impossible to test for these chemicals. Like, you can't find it. Your body's going to be exposed to it. So what's really important for us to tell you, and what we cannot repeat enough, is that you need to see your provider on a regular basis. In line with that, and the information that we're collecting from the Poison Control Center, and the information that we're collecting from our ERs and people going to the hospitals through syndromic surveillance, because this is all data that is still coming to the state, both Ohio and to PA, and that ACE survey. That ACE survey is usually not meant to be a one and done. We are making plans to do surveillance and continue surveillance with this community. So it means we'll be back, you'll have to see our smiling faces again, and you'll have to answer our dumb questions. But that's because the point of this is that long-term surveillance. So when you take your exposure that you reported and the symptoms that you initially reported in that ACE survey, and we have another ACE survey, and you're going to answer some different questions, and you continue to go and you continue to see your providers, and there's indication that there's changes in this community with certain levels of something, then that indicates to us that there's a further public health action that needs to take place. That is why we want you to go, that's why we provided that health clinic for you to go to.
Okay.
The temporary one? Right. Because it does take time to get contracts and services in place to provide you. It did take us. So from my understanding, the testing, and yeah, please help me here, it would have had to be done prior to and then after?
No, it can be done shortly after. But again, what are we gaining from doing the test? The problem, though, is that it can work the other way, too, because there are studies where workers had huge exposures to vinyl chloride, and their TG levels were normal. So then that can also prove that you didn't have exposure if you had a test early on. Do you understand what I mean? So I think that the question is really not why should we do the test to figure out what you had. It's more like we need to find out what tests to do so we can help you.
All right, so Lori has a yes or no question, and then we've got to take this offline.
Is this one of the most or one of the worst chemical accidents that you've ever worked with? Yes or no? To all the staff.
I'll start. Yes.
It's right in the middle. It's right in the middle for me. I've seen some really nasty ones. So, no, understood. Okay, so, yeah, thanks, Lori. And then Jill's gonna, yep, okay. Thank you.
Hey, everybody. I heard a couple people say, you're leaving, you're not here. I just wanted to remind you that we have amazing state and local public health partners here. We are in constant communication with them. So please, in addition to reaching out to your clinicians and your providers and hopefully getting those referrals to the Poison Control Center clinic in Pittsburgh, please reach out to them and utilize the great resources that they have put forward for you. And we will be in communication. If they need us, they know how to get us. And I just wanted to make that point that, we are here and we are available to provide assistance as needed. So thank you again.
And thank you all for taking the time to come here and helping answer questions. And within the next couple weeks or so, we're going to talk to work with Wes to bring a public health resource session together. So stay tuned for part 3. Thank you.